Hi class, welcome to another session on biomaterials. So today we shall discuss medical textiles. So any fabric or any material that is used to manufacture garments related to the medical industry is called as medical textile. Now, when I say garment, I mean either the surgical gowns that surgeons wear in the operation theatre, those disposable ones, or the cotton ones, the cloth ones, or the gloves, the cap, and accessories that the operation theatre personnel wear. It can also be the drape or the cover that is used to separate the patient's body from the other environment. The drape that the patient usually wears while going into the operation theatre, or it can be the bed sheet that is put on the theatre bed. It can be the clothing which is used to cover the sterilized surgical instrument. It can be anything that is used in the operation theatre or anything that is used in the wards is called as a is the medical textile. Now, not just gowns or drapes, it can also be the material that is used to manufacture the wound dressing. The adhesive tapes that are used, or the gauze bandage that is used to wrap the wound, or the gauze pad that is used to apply medication on the wound, and so on. So all these are categorized as medical textiles. So broadly, medical textile can either be implantable, non-implantable, it can be extracorporeal, or it can be healthcare and hygiene material. So whatever I spoke about now is healthcare and hygiene material, the grounds, the drapes and everything. Extracorporeal is, it can be the membranes and other material that is used in medical devices. Implantable medical textile is as the name suggests, the material that is implanted in the body, and non-implantable is used for superficial purposes. So let us have a closer look at these medical textiles. So, implantable medical textiles are the material that are used to repair the body. For example, sutures or surgical mesh that is used to, fixate a herniated, fixate the hernia, abdominal hernia, or it can be vascular graft or artificial ligaments and so on. Non-implantable ones are used for external purposes. So these are absorbents, those absorbent sponges that come to absorb fluid, or it can be drapes, etc. Extracorporeal is like mechanical organs for applications such as blood purification. So artificial kidney or dialysis machine is an example of that. And then hygiene and healthcare, these are the textiles that act as a barrier and prevent the spread of infection. So it can include surgical drapes, gowns, gloves, bedspreads, pillow covers, etc. So these are the various types of medical textiles, broad classification. Now, for a medical textile, for a material to qualify as a medical textile, it has to satisfy certain prerequisites. For example, first of all, it should be non-toxic. You know, when it comes in contact with the body, it shouldn't be infusing toxins inside the body. So by diffusion or osmosis or any other way. If there's an open wound, then the textile should not induce an infection through the open wound inside the body. Or it shouldn't be releasing toxins. Then you have it should be non-allergic when it comes in contact with the patient's body. The patient's skin shouldn't become allergic to the material. And of course, it should be non-carcinogenic because obviously you don't want yourself to be subjected to risk of developing cancer because you come in contact with a certain material. Also, it should be antistatic, because patients usually are lying down for a longer duration, and if it develops, static charge, then, it becomes uncomfortable. At the same time, static electricity can affect the functioning of medical devices. So therefore, the material should be anti-static. It shouldn't be, developing any static energy. Of course, it should be biocompatible. I mean, anything in biomaterials that we are reading should be biocompatible. Also, an important factor is that it should be flame proof, because you in operation theatre often you use devices such as the cautery machine to either seal or open a wound, and that generates quite a lot of heat, and that heat by any chance should not cause and it should not inflame the material, because you're using this material as a drape for the patient as well. So by any chance, if the cautery machine or the cautery tip touches the material shouldn't catch fire and shouldn't be causing any flame hazard. At the same time, if for some arbitrary reason the hospital, a certain section of the hospital has caught fire, then this textile should protect the patient as much as possible and should not be aiding the spread of fire and put the patient at the risk of receiving burns. Now, there are some commonly used fibers for manufacturing medical textiles. So there are natural ones and there are synthetic ones. So natural one is a cotton, silk, or wool, and then synthetic you can have polyester, polyamides, or polytetrafluoroethylene, right? PTFE. So I think that's all I have to speak about medical textiles. I hope you had a fruitful session learning about these with me, and I shall see you again with another video. I hope you take care till then. Bye.